On this edition of Independent Sources, no safe haven. Immigration advocates and lawmakers try to bolster the powers of sanctuary cities as a battle with the federal government looms. And Old School Colony, a Puerto Rican photographer takes a fresh look at the island's visual history and discovers a penetrating legacy of colonialism that's still present today.
Independent Sources, your window to the city's ethnic and immigrant communities. Your host this week, Zyphus Lebrun.
Lawmakers and immigration advocates are empowering sanctuary cities around the country with the legislative might to resist many of President Trump's anti-immigration legislation. A recent gathering of these officials in New York City resulted in several guidelines being laid out, including a plan to create new sanctuary policies and bolster old ones that will protect immigrants in designated sanctuary cities. This at a time when Attorney General Jeff Sessions has promised to cut federal funding to any of these municipalities that fail to comply with immigration enforcement officers. I sat down with Ana Maria Archila, the co-executive director of the Center for Popular Democracy, a nonprofit social justice collective. We talked about the strategies that have been put in place to protect immigrants and the impending clash with the federal government. Ana Maria, thank you for joining me in studio today.
Thank you for having me.
Okay, so let's talk a little bit about this meeting that was recently put together, immigration advocates and legislators, to talk about sanctuary cities. Your organization, the CPD, was very instrumental in getting these folks together. Can we talk a little bit about some of the major points that came out of that meeting?
Yes, so the Center for Popular Democracy is a network of community organizations across the country, mostly rooted in African American communities and immigrant communities. Ever since Trump got elected, we started getting lots of phone calls from local elected officials in cities and counties who were very concerned about Trump's anti-immigrant agenda and hateful rhetoric and wanted to put in place protections for the people they represent. So we just recently had a convening of local elected officials. Out of the convening, elected officials that came from over 30 cities said we are going to put in place more policies that refuse to use local dollars to incarcerate immigrants just so that ICE can deport them. So they'll just use the local jails for criminal convictions, but not for holding immigrants waiting for detention and deportation. They will actually examine the ways in which their local police is facilitating, kind of funneling people into the criminal justice system that then funnels them into deportation. They will put in place programs to facilitate immigrants having access to legal counsel, because in our country, people may not know this, but people who are in deportation process actually don't have, we don't have a kind of a right of legal counsel in the same way that we have in a criminal process. So cities like New York, cities like San Francisco, LA, Boston have stepped up and said, we know that that's not fair. We are going to use local money to make sure that people have representation when their time to go to court, immigration court, comes.
In light of those sorts of policies that are being created, there are also existing policies, for instance, Secure Communities, which essentially says that the local government must assist, ICE with their proceedings. Can municipalities essentially say no to Secure Communities?
Absolutely. So there is nothing in federal law that mandates cities to do the role of the federal government. And when cities say we refuse to use our local dollars to detain people because they are undocumented, they're basically saying we're going to use our local dollars for what is actually our constitutional responsibility and authority. The Secure Communities program is a federal program that tries to entice localities to use their dollars to basically do the job of the federal government. So cities have the right to refuse to participate in these programs. The federal government under Trump wants to intimidate cities into believing that they don't have that right, or like acquiescing because they will be punished. But in reality, cities have the constitutional authority to refuse to do the federal government's job.
We'll come back to that notion of punishment in a second.
Yes.
But first I wanted to talk about You know, we had an immigration advocate on the show a couple of weeks ago, and he talked about the fact that the role of, you know, broken windows and so forth in criminalizing many immigrants, and how easy it is to fall into the criminal system, and so that leads to the possibility of deportations. What's going on that front to perhaps create a system where, you know, folks who may, you know, walk around with an open container are not arrested, and then, you know, if they don't have the documents, proper documents, sent on their way to being deported for having a can of beer open without a paper bag?
One of the themes that really came out of this convening of elected officials was really the fact that we understand very clearly that the policies around that that municipalities put in place policies that funnel people into the criminal justice system unnecessarily, and that actually cities can do more than just refuse to participate in the enforcement of immigration law. They can examine how they are funneling young people into the criminal justice system by having violations, you know, like disorderly conduct inside schools criminalized. Like that could be a civil violation that gets dealt as a summons and not as a misdemeanor. So there are lots of conversations about changing. Really, if you want to establish sanctuary is not possible if it's just for immigrants. It has to be a disposition towards not hurting communities broadly and changing the ways that municipalities are funneling people into the criminal justice system is fundamental, whether it is by changing open container laws, by changing the way that young people get charged, by getting police officers out of schools, by making sure that street vendors have more licenses so that they're not unnecessarily ending up in the criminal justice system because they're just basically trying to survive. There are lots of things that cities can do, and the elected officials that got together said, we understand this connection and we are committed to making change in our cities.
Okay, so to go back to the point that we skipped over a little bit, Attorney General Jeff Sessions has been very clear that any municipality that resists assisting ICE and so forth will face cuts, federal cuts. What's the feeling as regards to that from the folks in under your umbrella organization?
The Attorney General is saying what actually President Obama had already said, which is we will, you know, the federal government will try to use the threat of federal cuts to force cities and counties into compliance with programs that the federal government is trying to put in place to use local police or local jails as an extension of the immigration enforcement system. What we know is that cities that are refusing to use their own money to do the federal government's job are acting within their constitutional authority. So they're not violating any law, they're not participating in some sort of civil disobedience. They're basically using what the Constitution says is their role to actually do their jobs. We already know that what the federal government, the kind of money that the federal government can take away is money that's related to law enforcement. So if President Trump wants to really say that the federal government will take away money for terrorism protection that the NYPD needs, that's a politically very difficult thing to do. And the cities see that. And the people that convened in this gathering of sanctuary cities said, we are not going to be intimidated by the federal government's threats, first of all. And second, we know that the federal government cannot take funding away that's unrelated. So they can't really take, for example, funding related to schools, funding related to healthcare, funding related to transportation and infrastructure. What they could take away is like Department of Justice grants and things that are important, but that are, essentially about keeping people safe. So the elected officials that joined felt very committed to really using the constitutional authority of cities to protect their residents and not really counting down to the threats of Attorney General Sessions or President Trump.
And just finally, before we end, Ana Maria, there has been a certain criticism of elected officials under this umbrella of sanctuary cities folks have accused them of grandstanding, not truly having any sort of power to protect people because of federal legislation. It seems to me that's not the case. Am I correct in assuming that?
It is absolutely true that the federal government can do its job anywhere in the country. So if ICE agents show up in the corner of 5th Avenue and 34th Street to conduct a raid, they actually have the power to do that. No matter what sanctuary cities policies we have in place, that cannot be prevented. But what the cities can do is say, we're not going to hold people in jail after they complete their sentence so that you can come and get them. So President Trump will not be able to truly execute his anti-immigrant agenda of deporting 2 to 3 million people without the collaboration of cities and counties. And what we are doing is really helping cities and counties and the communities in those places stand up real policies that have teeth, that establish new, what I like to call a ring of fire around our communities against the threat coming from the federal government. But you know, President Trump will do bombastic things like raids in the big sanctuary cities to make people feel afraid and to feel like the protections of their cities are easy to pierce. But even though they can do that, they truly cannot grab the millions and millions of people that they would otherwise if cities begin to facilitate this process.
Ana Maria Archila, thank you very much for being in studio.
Thank you so much for having me.
When we come back, growing concerns that mentally and physically ill immigrants are not seeking the assistance they need for fear of being deported. Thanks for staying tuned. Several hospitals around New York City are reaching out to immigrants with a message. Don't be afraid to come in for the care that you need. Many city hospitals are reporting a steep decline in their immigrant clientele since the marked increase of immigration enforcement raids around the country. Advocates and hospital officials are scrambling to ensure that mentally and physically ill patients are not being left without the care that they desperately need. I spoke with Claudia Calhoun, the Director of Health Advocacy at the New York Immigration Coalition, and Javier Castaño, the publisher of the newspaper Queens Latino, about the issue. Javier Castaño, Claudia Calhoun, thank you for joining me in studio today.
Thank you for having us.
All right. So, Javier, I'm going to start with you. You wrote a piece for your newspaper, Queens Latino, focusing on this issue of immigrants, the numbers of immigrants going to some hospitals around the city being, declining significantly over the last couple of months and so forth. Let's talk a little bit about that. What was the reasoning that some of these hospital administrators, why did they think this was happening?
I believe that they noticed that there is a decline of clients or people attending the hospitals. And there was a forum at the Elmos Hospital. And at the beginning, they didn't talk about the number of people attending the hospital. But then the CEO, Israel Roca, mentioned that some people are afraid of getting information. And other people just go to the emergency room, leave the sick person there and leave because they're afraid that the immigration agencies are around there. And there was one doctor from the psychiatric department who said that the number of people attending that department declined almost to zero because people are really, really afraid. And those are new immigrants in the city of New York, so it is really bad.
Really? Now, one of the things kind of coming out of this, Claudia, is this whole notion of people being afraid, perhaps, that, the hospital is a place where ICE can come in and pick them up. Is that the case?
So that ICE has some sensitive areas that by their own policy that they do not do immigration enforcement in. And those are schools and hospitals and houses of worship. And those are still standing. Those are still on ICE's website as places that they declared that they do not pursue immigration enforcement. And that was even after the February memo that came out that laid out some different strategies or some changes in how immigration enforcement was working. And so we want to let people know that as long as that is ICE's policy, and especially based on everything that health and hospitals, public hospitals in New York City has done to make itself a safe, protective space for immigrants, that we want people to make sure that they continue to seek services when they need it, that they go to see a doctor when they don't feel well, or they go to keep appointments that they had scheduled.
Is there any kind of concrete evidence coming from these organizations, these hospitals, saying that, hey, listen, this is directly associated with the more, if you will, stiffer immigration policies or anti-immigration policies that have been put in place?
We are living in a time where there's a lot of things happening very quickly, and there's a lot of fear, and there's a lot of rumors going around. And so I think it is, anecdotally, we do know that H&H has reported that there have been increases in canceled appointments, for example. Whether that is only related to immigration or whether that's driven by immigration, I think is something that, to really show like the connection, like a real causation, you would have to look at very carefully. But it is the fact that they are seeing that anecdotally is making them, based on my understanding, very concerned about it, and they're monitoring it very closely. We, sort of on the advocacy side of things, and who work with member organizations that take care of people that also call their community-based organizations to provide social services and express a tremendous amount of fear and a tremendous amount of anguish and insecurity and still instability and not wanting to leave the house because they don't know what would happen. We feel that it is just very plausible and very likely that it is having an impact on people's ability to seek care when they need it. Having said that, we do want to make sure that we understand sort of the broader phenomena that's happening. That's something that will take time. What we're trying to do in the meantime, and what we think H&H is doing a pretty good job of, is making sure that people know that health and hospitals are a safe space, that they don't actually collect information on immigration status. It's not in the electronic medical record. It's not asked, it's not solicited in the electronic medical record. So even if that information comes out in the course of a clinical encounter or an appointment, there's not a place for the provider to note that.
Right.
So that's another aspect of the data that makes it safer to use healthcare services. Those data are also protected by HIPAA, the federal healthcare privacy law. It imposes federal protections on what the hospital does with those data, and we do believe that could be very important if there was ever any question about who has access to those records. And the other thing I wanted to say about mental health, I think that one of the things that is happening right now in this moment is that even not necessarily people who have a diagnosis of mental illness like depression or anxiety, but just people who are may not be sort of what we would call mentally ill, but they may be experiencing anguish and insecurity and instability and fear, and that is also a part of what helps people stay healthy, is the ability to be free from that. And so I do think we are in a moment where the impact, regardless of sort of the cause and effect, we know that the impact of federal immigration changes is creating a little bit of a toxic environment. It's not creating a healthy environment here in New York City.
But the fall of that environment is by the media, the mass media, and the Democratic Party. The media, especially Univision and Telemundo, they keep saying that there are raids dividing our families in the city of New York, and that is not true. There are no raids. And the other part is that the photo at the Elmhurst Hospital was 2 weeks ago, but then there was another photo at town hall meeting by Councilwoman Julissa Ferreras and the Mayor Bill de Blasio. And the mayor recognized that there is not a unified answer from the Democratic Party to respond to this immigration, let's say, climate. And each politician, they want to make their own press conference and scare people. And they are also lying, some people saying that, President Trump is going to deport between 2 and 3 million people per year. He has never said so. So they have to check the facts too, and count people and give the information in a unified and straight way.
There are definitely raids, and people, I think, are just more aware of them.
I have the feeling that there have been people arrested, but no raids. Raids is those that occur during the 70s and 60s on Roosevelt Avenue, that they closed the entrance of the train and people just jumped to the rails. But in this case, it's just people that have been arrested because they have an order of deportation or something like that. But we keep receiving calls from people saying, Javier, there are a bus or a truck on Roosevelt Avenue, on Johnson Boulevard, picking up people. And I said, okay, but where exactly? Oh, I called you later. They never called because that's a rumor that is spread on social media and by phone, but no raids in the city of New York.
So you're saying arrest, not raids?
Oh, yes. You have to clarify that.
Right, right. You're essentially creating that
Of course.
tension that we were just talking about. That's
You know
fair.
how many people the government has to arrest to deport between 2 or 3 billion
People, yeah, that's
in 4 or 8 years like President Obama did? You
Yeah.
have to keep arresting people.
yeah.
That's the only way.
No, absolutely. One of the things before we close, because we're running out of time, Claudia, how much are the hospitals doing along with organizations like NYIC to kind of inform people about what's going on? Is there any kind of outreach that's going on right now?
The Health and Hospitals system put out an open letter to immigrants, which is on their website, and it's worth looking at. It specifies that Health and Hospitals will protect their data to the fullest extent of the law, and that what they care about is people coming in and get services and taking care of them. And so the forum that we've been speaking about was one of a series of forums that Health and Hospitals had in several different boroughs that we've supported and been part of putting together the program for. We know that probably the people that come to the hospital for a forum aren't necessarily the ones that need the information the most. And so that was the other message that really came out of those was please tell your family members, please tell your friends. And forums like this are really important because leveraging the media outlets like Javier's is really key because those are some of the ways that people get that information. They don't watch CNN necessarily, and so I think that it will be an ongoing long battle. And of course, that's all happening in the context of sort of things that come out of Washington.
Right. All right. Claudia Calhoun, Javier Castaño, thanks for joining me.
Thank you.
Thank you.
For having us.
Still to come on the show, a Puerto Rican photographer creates his own museum to take a fresh look at his native country's colonial past and present. Finally from us, Puerto Rican photographer Pablo Delano has created his own museum to take a fresh look at his native country's colonial past and present. The installation is called the Museum of the Old Colony and is currently on display at the King Juan Carlos I of Spain Center at NYU. Judith Escalona tells us more in this report.
Pablo Delano's The Museum of the Old Colony is a sprawling art installation of oversized photographs parodying ethnographic museums.
Those museums often are in countries that have been colonial powers. Often they are ethnographic museums, museums of mankind, museums of humanity or whatnot, in which colonized cultures are represented in a way that subtly, sometimes not so subtly, sometimes overtly, strengthen the notion that the colonial overlord knows best.
Full of irony and insight, the installation is a pictorial history of Puerto Rico that challenges the very notion of an ethnographic museum.
Another one of the factors that really provoked the title, which I think is a kind of poetic title, the Museum of the Old Colony, has to do with certain museums that were really quite unimaginable by today's standards. For example, there were museums in which live human beings were used as exhibits.
The American Museum of Natural History in New York City was one of them. In the late 19th century, 6 members of the Inuit people from Greenland were displayed as specimens and lived in the museum's basement.
This was the norm, and museums had very complex exhibits explaining how certain people were inferior because of the size of their skulls, and they had skin color charts and all of this, so it was a kind of scientific racism.
Having collected over several years photographs, prints, stereoscope cards, films, and videos chronicling Puerto Rico's history, Delano had the idea of creating his own museum.
It occurred to me somewhere in the last 20 years to try to incorporate that metaphor for a museum, to try to create a museum that was actually kind of a mockery of those sorts of museums. And the subject matter that seemed very appropriate to me to use is a subject matter that I'm familiar with and that I grew up with, which is the colonial situation of Puerto Rico.
Pablo Delano was born and raised in Puerto Rico, where his father, Jack Delano, and mother, Irene, documented conditions on the island for the U.S. government. His parents became so enamored with the culture they decided to remain on the island rather than return to the U.S. Jack Delano's photographs are among the finest visual records of Puerto Rico. Like his father, Pablo Delano has embarked on creating a visual narrative of the island. Unlike his father, his narrative is transgressive in using the very images of the colonial power to undermine it.
A lot of the images in the exhibit come from very soon after the U.S. invasion, 1898, 1899, 1900, 1907, 1903, and those images were clearly propagandistic. I mean, they were meant not to be shown in Puerto Rico at all.
Those early images were for American consumption. There are photographs of dusky Puerto Rican belles, rows of pickaninnies, or the girl an American soldier left behind.
They were meant to be shown in the U.S., to show people in the U.S. that all this colonialist moves were justified, and how they were going to take these poor who were, somehow worthy of the attention of the great American empire, but not quite equal.
Yet, in an ironic historical twist, the government of Puerto Rico began issuing its own propagandistic images.
50 years later, the government of the island, actually the Puerto Rican government, issued a whole series of propagandistic images to sort of celebrate the success of their colonial experiment. So if you look at some of the images, for example, there's a man in Mayagüez riding a bicycle completely decked out with American flags, and another one of these images is called School for Maids, and it shows a photograph of Puerto Rican women being trained to be housemaids in Westchester County, New York.
The images speak for themselves, but the captions accompanying each of them scream irony. The title of the exhibition is also satirical. Its name reflects Puerto Rico's continued colonial status as well as an American soft drink. Old Colony was brought to the island in the 1940s.
My understanding is that it was the soldiers who were stationed at the various military bases who demanded it and wanted it. So it was brought in and sold at the military bases, and it became a very popular soft drink in two flavors, uva, grape, and piña, pineapple, and it's actually sold to this day.
Some of the images of the 1950s and 60s gain a certain poignancy given the social and economic crisis Puerto Ricans are currently facing. A segment from a 1960s film is also part of the installation.
We celebrate the 4th of July.
Delano says the documentary's title, Puerto Rico, Its Past, Present, and Promise, is a foreshadowing of the current Promesa, or Promise Control Board, that now manages the island nation.
What they see as promise is that it will develop and be a contributing part of the United States. But as the documentary says, we are not a colony, it says in the documentary, but we are not a country. So it's very much a kind of, I guess, promotional, or it became a kind of promotional idea for this Estado Libre Asociado.
That is, the Free Associated State, the current colonial government. Judith Escalona, Independent Sources.
The Museum of the Old Colony runs through May 12th. That's our show this week. Thanks for staying tuned. Till next time, be independent-minded.